Happy learning.
Hi, welcome to our Pharma Topics channel. Welcome to the B.Pharm 6th semester Pharmacology 3 series. We are going to deal with Unit 4, Chemotherapy of Cancer. It contains 8 subdivisions: classification of anti-cancer drugs, alkylating agents, antimetabolite drugs, cytotoxic antibiotics, plant-derived anti-cancer drugs, hormonal anti-cancer drugs, targeted therapies in cancer, and miscellaneous drugs which are used in cancer. We are going to deal with 32 questions, probable questions with answer explanations in this section. Let us see the first question. It is classification of anti-cancer drugs. In the question paper, they may ask anti-neoplastic drugs also. It also determines the same question. It is anti-cancer drugs only. There are about 6 classifications. You remember this. It will be very useful. It may be asked in a 5 mark or 10 mark question. First set is cancer agents that forms covalent bonds with the DNA and reduce the multiplication of the cancerous cells. They are alkylating agents and they are cell cycle non-specific. It is of nitrogen mustards, cyclophosphamide, chlorambucil, bendamustine, nitrosoureas, CARMUSTINE, lomustine, platinum compounds, CISPLATIN, carboplatin, oxaliplatin, and others are BUSULFAN, dacarbazine, and hydroxycarbamide. Second set of drugs are cancerous agents that block synthesis of DNA or RNA via folate, pyrimidine, or purine pathways. They are called antimetabolites. They are cell cycle specific. They act at the S phase of the division of the cells, cancerous cells. It is of 3 kinds: folate antagonists, methotrexate, pemetrexate, then pyrimidine analogs, fluorouracil, capecitabine, gemcitabine, and tegafar. Then purine analogs, mercaptopurine, cladribine, and fludarabine. Third set of drugs are cytotoxic antibiotics. They are cell cycle non-specific. They are anthracycline antibiotics, doxorubicin, daunorubicin, mitoxantrone, and others are bleomycin and D-actinomycin. Then the fourth set of drugs are natural products as anti-cancer drugs. You remember 2 set of drugs in this. Topoisomerase inhibitors. There are 2 types of topoisomerases. Topoisomerase 1 inhibitors are irinotecan, topotecan. You just remember I, that is irinotecan starts with I. You remember as top 1. Then topoisomerase 2 inhibitors are etoposide and teniposide. Topoisomerase 1 inhibitors are cell cycle specific, G1 phase specific. And topoisomerase 2 inhibitors are cell cycle specific and G2 phase specific. Mitotic spindle inhibitors, since the letter starts with M, you remember these drugs are cell cycle specific, M phase specific. They are polymerization inhibitors, vincristine, vinblastine, depolymerization inhibitors, taxanes, paclitaxel, and docetaxel. Then hormone agonists and antagonists are synthesis modulators for cancer treatment. They are cell cycle non-specific. They are progesterone, gonadotropin releasing hormone analogs, leuprolide, goserelin, somatostatin analogs, octreotide, lanreotide, antiestrogens, tamoxifen, fulvestrant, aromatase inhibitors, anastrozole, letrozole, exemestane, antiandrogens, flutamide, bicalutamide. Then the 6th category is targeted therapies in cancer. They are cell cycle non-specific. They are of 2 sets. One is monoclonal antibodies. They are T-cell breaks, programmed death ligand 1 inhibitors, nivolumab, CTLA4 inhibitors. Both are T-cell breaks. They are used in T-cell cancers, ipilimumab, and monoclonal antibodies against cluster differentiation antigens, that is CD antigens. Whichever CD antigen is you are able to remember, you remember 2 or 3 monoclonal antibodies you can represent in this category. CD3 is blinatumomab, CD20 is rituximab, and CD52 is alemtuzumab. Then monoclonal antibodies against EGFR, epidermal growth factor, and HER2 are cetuximab, trastuzumab, and monoclonal antibodies against vascular endothelial growth factor, bevacizumab. Then the targeted therapies in cancer are small molecule inhibitors. There are several small molecules which are concerned with the uncontrolled proliferation of cells, that is cancerous cells. They are tyrosine kinase inhibitors, imatinib, proteasome inhibitors bortezomib, CDK inhibitors palbociclib, hedgehog pathway inhibitors sonidegib, histone deacetylase inhibitors orinostat, isocitrate dehydrogenase IDH2 inhibitors enacidenib, BCL2 inhibitors venetoclax, then selective inhibitor of nuclear transport SINE, that is selinexor. Whichever is you are able to remember in this category, you remember that. So this is the entire classification of all the anti-cancer or anti-neoplastic drugs which will be useful for you. The next is a short note on anti-cancer drugs, that is alkylating agents. Alkylating agents are of 6 categories. They are nitrogen mustards, cyclophosphamide, ifosfamide, meclorithamine, mephalon and chlorambucil. Ethylene imines are thiotepa, altritamine. Alkyl sulfonates, busulfan. Nitrosoureas, carmustine, lomustine, streptozotocin. Triazines, procarbazine, dacarbazine, temozolomide and platinum compounds, cisplatin, carboplatin and oxaliplatin. So they may ask a short note of alkylating agents. You may give the classification first. Question number 3 is a short note on cyclophosphamide. It's a nitrogen mustard bifunctional alkylating agent. It cross-links the DNA strands by bonding with guanine residues in the cancerous cells. It's used in treatment of non-Hodgkin's lymphoma, myeloma, leukemia, ovarian, breast and other tumors, and it is also used in treatment of rheumatoid arthritis. The adverse effects: anorexia, nausea, vomiting and bladder toxicity, that is hemorrhagic cystitis. It is caused by accumulation of the metabolite acrolein, and it is the incidence is reduced by taking copious amount of water with the antidote to mercaptoethane sulfonate. The drug interactions with the cyclophosphamide, it should not be given with rifampicin. It increases cyclophosphamide toxicity. With the doxorubicin, cardiotoxicity is increased, and cyclophosphamide, when combined with other anticancerous drugs, it increases bone marrow depression. Question number 4 is a short note on CISPLATIN. It is a reactive platinum compound anti-neoplastic agent. It forms reactive metabolites that covalently bonds the DNA bases and cross-linking DNA strands. It's an alkylating anti-cancer agent used in treatment of testicular, ovarian, cervical, bladder, lung, head and neck cancers. It is highly emetogenic. It causes severe nausea and vomiting, renal toxicity, ototoxicity and tinnitus. When compared to other anti-cancer drugs, it causes less bone marrow depression. To reduce the renal toxicity of cisplatin, amifostine is the antidote which is used. Cisplatin, when it is co-administered with aminoglycosides or loop diuretics, it increases the nephrotoxicity. Question number 5 is busulfan. A short note on busulfan. It's a DNA intercalating agent or alkylating agent, anti-cancer drug. It alkylates the DNA and damages it by cross-linking the DNA strands. It is used in treatment of chronic myeloid leukemia. The adverse effects include pulmonary fibrosis, bone marrow depression, adrenal insufficiency and seizures. Question number 6 is CARMUSTINE. A short note on CARMUSTINE. It's a DNA intercalating agent. The same mechanism, it cross-links the DNA strands in the cancerous cells and causes inhibition of DNA and RNA synthesis. It crosses the blood-brain barrier. It is used in treatment of brain tumors such as glioblastoma, then multiple myeloma and lymphomas. The adverse effects include CNS toxicity, bone marrow suppression, nephrotoxicity and pulmonary fibrosis. Question number 7 is antimetabolite anti-cancer drugs. There are 3 sets of antimetabolite anti-cancer drugs. They are pyrimidine analogs, 5-fluorouracil, cytarabine, gemcitabine, purine analogs, 6-mercaptopurine, 6-thioguanine, pentostatin, cladribine, then folic acid analogs, methotrexate and pemetrexate. There may be a short note on fluorouracil. It is a pyrimidine antimetabolite. It is converted to active nucleotide form that inhibits an important enzyme, thymidylate synthase. And this drug is cell cycle specific, that is S phase specific. It is used in treatment of colorectal, breast, gastric and pancreatic cancer and topical therapy for solar keratosis. Adverse effects include diarrhea, vomiting, stomatitis, alopecia, leukopenia, and thrombocytopenia. The antidote to reduce the toxicity of fluorouracil is uridine triacetate. Fluorouracil, when it is combined with other anti-cancer drugs, it increases the hematological toxicity. Fluorouracil should be never combined with irinotecan because it causes severe sepsis toxicity. Question number 8 is a short note on GEMCITABINE. It's antimetabolite anti-cancer drug, deoxycytidine antimetabolite, cytarabine analog. It is converted to gemcitabine diphosphate and triphosphate that competes with the deoxycytidine triphosphate for incorporation into the DNA and prevents the DNA replication and repair. It is used for treatment of advanced metastatic or relapsed breast, pancreatic or ovarian and non-small cell lung cancer. Adverse effects include anemia, leukopenia, thrombocytopenia, stomatitis, dyspnea. Uridine triacetate is an antidote for gemcitabine, reducing the toxicity. It is used. Gemcitabine, when combined with other anti-cancer drugs, it may increase the hematological toxicity. Question number 9 is a short note on mercaptopurine. It's a purine antimetabolite anti-cancer drug. It is converted to nucleotide triphosphate by phosphoribosyl transferase, inhibits purine synthesis. It is also cell cycle specific, S-phase specific. It is used for treatment of acute leukemia, chronic myeloid leukemia, and lymphomas. Adverse effects include myelosuppression, hepatotoxicity, and hyperuricemia. Mercaptopurine, when combined with allopurinol, it increases the toxicity of mercaptopurine. Question number 10, a short note on methotrexate. In several question papers, methotrexate has been asked. It's a very important question. It's a folate reductase inhibitor used as anti-cancer drugs. It inhibits dihydrofolate reductase in the cancerous cells. And it inhibits the formation of purines and pyrimidines from the DNA. It is cell cycle specific, S-phase specific. It has several uses used for treatment of choriocarcinoma, trophoblastic tumors, leukemia, breast, head, neck, and lung cancers. It's also used at lower doses for treatment of rheumatoid arthritis and severe psoriasis. The adverse effects include myelosuppression, anemia, leukopenia, thrombocytopenia, stomatitis, hepatotoxicity, and nephropathy. The antidote to reduce the methotrexate toxicity is leucovorin. Folic acid can also be used as an antidote. The drug interactions include with other cancerous drugs, anti-cancerous drugs. It increases the hematological toxicity. Question number 11, they may ask, what are the natural products used as anti-cancer drugs? There are 6 drugs: vinca alkaloids, vincristine, vinblastine, vinorelbine, taxanes, paclitaxel, docetaxel, epipodophylotoxins, etoposide, teniposide, camptothecins, they are topotecan, irinotecan, anti-tumor antibiotics, they are anthracycline antibiotics, doxorubicin, daunorubicin, epirubicin, mitoxantrone, then bleomycin, deactinomycin, and mitomycin C. An enzyme is also used as a natural product, which is used as anti-cancerous drug, is L-ASPARAGINASE. Then they may ask a short note on vincristine, question number 12. It's a vinca alkaloid obtained from Catharanthus roseus. It's a mitotic inhibitor. It binds to tubulin and prevents polymerization of tubulin dimers, which helps in cell division in the cancerous cells. It is cell cycle specific, which is M-phase specific. It's used for treatment of Hodgkin's disease, lymphomas, leukemia, neuroblastoma, Wilms tumor, and other tumors. The adverse effects include nausea, vomiting, alopecia, and peripheral neuropathy. With mitomycin, it increases the risk of bronchospasm. Vincristine should not be given with live viral vaccines because it reduces the efficacy of live viral vaccines. Then a short note on paclitaxel, question number 13. It's a mitotic spindle inhibitor. It binds to tubulin and prevents depolymerization of microtubules, which helps in cell division in the cancerous cells. It is cell cycle specific, M-phase specific. It is used for treatment of advanced ovarian cancer along with CISPLATIN, non-small cell lung cancer, metastatic ovarian or breast cancer, which are unresponsive to first-line drugs. The adverse effects include diarrhea, vomiting, alopecia, hematological toxicity, peripheral neuropathy, arthralgias and myalgia. Paclitaxel, when co-administered with other anti-cancer drugs, increases the hematological toxicity. Paclitaxel should not be combined with ketoconazole. It causes serious toxicity. And then the question number 14 is irinotecan. It is a camptothecin natural anti-cancer drug. You remember the letter, it starts with I. You remember it as Roman letter 1. It inhibits topoisomerase 1 in the cancerous cells, causes excessive DNA supercoiling, causes DNA strand breakage and cell death. It is cell cycle specific, G1 phase specific. It is used for treatment of recurrent or metastatic solid tumors. Irinotecan is specific for metastatic colon cancer, whereas topotecan is specific for metastatic ovarian or cervical cancer. Adverse effects, diarrhea is more prominent with irinotecan than bone marrow depression. Question number 15, a short note on etoposide. It is a epipodophylotoxin, topoisomerase 2 inhibitor. It prevents resealing of the nicked strands of DNA, causing DNA strand breaks. It is cell cycle G2 phase specific. Used in treatment of testicular and small cell lung cancer, non-Hodgkin's lymphoma and leukemia. Nausea, vomiting, leukopenia, thrombocytopenia and alopecia are its adverse effects. With other anti-cancer drugs, it increases the hematological toxicity. Then a short note on doxorubicin. It's a DNA alkylating agent, anti-tumor antibiotic. It's an anthracycline antibiotic. It has multiple mechanisms. It inserts between DNA bases, causing deformation and uncoiling, forms hydroxyl free radicals, causing DNA strand break, and inhibits topoisomerase 2 also. It is also cell cycle specific, that is S phase specific. It is used in treatment of breast, ovarian and bladder cancer, treatment of lymphomas and leukemia. The prominent adverse effect is cardiomyopathy, that is dose related, and causes anemia, leukopenia and thrombocytopenia. You may remember ruby. Ruby is red, so it causes reddish coloration of urine. And the cardiotoxicity can be reduced by using an antidote called dexrazoxane. The drug interactions with other anti-cancer drugs and radiation, it increases the hematological toxicity. Question number 17 is D-actinomycin. It's a DNA alkylating agent. It intercalates between the cytosine and guanine bases. It inhibits DNA-dependent RNA polymerase and impairs both the DNA and RNA synthesis. It's used in treatment of several solid tumors, including Wilms tumor, Ewing sarcoma, and metastatic testicular cancer. Question number 18, a short note on bleomycin. It's an anti-tumor antibiotic, DNA intercalating agent. It forms a complex with iron and binds with the DNA and forms free radicals that damages the DNA and breaks it. It is cell cycle G2 phase specific. It is used in treatment of Hodgkin's and non-Hodgkin's lymphoma, testicular carcinoma. The adverse effects include pneumonitis, pulmonary fibrosis, and hyperpigmentation. It is one of the drug where the myelosuppression is very rare. With other anti-cancer drugs and radiation, it increases the hematological toxicity. Then a short note on anastrozole. Anastrozole is a non-steroidal aromatase inhibitor, a estrogen antagonist. It inhibits aromatase, and which is essential for conversion of androstenedione to estrone. So it is useful. It halts the progression of estrogen-sensitive breast cancer. It is the first-line treatment for advanced and metastatic breast cancer in postmenopausal women. Adverse effects include nausea, headache, hot flushes, and back pain. Question number 20, LEUPROLIDE. It is a hormonal anti-cancer drug. It's a gonadotropin-releasing hormone analog. By continuous administration, it downregulates the gonadotropin-releasing hormone receptors and decreases follicle-stimulating hormone and luteinizing hormone secretion. It's used to treat central precocious puberty and advanced prostate cancer, endometriosis, and uterine fibroids. Adverse effects, it may cause a transient increase in testosterone that may lead to hot flushes. So usually it is addressed with flutamide or other anti-androgens. Question number 21 is tamoxifen. It's a hormonal anti-cancer drug. It's a estrogen antagonist in the breast tissue and suppresses breast tumor growth. It's used in treatment of breast cancer and ductal carcinoma, advanced breast cancer, and prevention of breast cancer in high-risk persons. The adverse effects include hot flushes, menstrual irregularities, increases the risk of stroke, pulmonary embolism, and uterine cancer. With estrogens, the efficacy of tamoxifen is reduced. Question number 22. These are targeted therapies. CETUXIMAB, it is a monoclonal antibody. It binds to EGFR, that is epidermal growth factor receptor, which is essential for cell division. Usually it is overexpressed in some cells, some of the cancers. And this drug is specific for such type of cancers. So used in treatment of colorectal cancer in combination with irinotecan, and head and neck cancer in combination with radiation therapy. The adverse effects include acne like skin rash and hypersensitivity. Question number 23 is trastuzumab. It is a monoclonal antibody specific drug against epidermal growth factor 2 or HER2 in breast cancer, used for treatment of metastatic breast cancer that overexpresses HER2. The adverse effects include abdominal pain, anorexia, diarrhea, allergic reactions. Trastuzumab, when combined with doxorubicin, it increases the cardiotoxicity. Question number 24 is imatinib. It is a very important drug asked in several question papers. It's a tyrosine kinase inhibitor, anti-cancer drug. It inhibits the translocation, that is BCR-ABL gene, which is overexpressed by Philadelphia chromosome. That usually happens in some chronic myeloid leukemia and gastrointestinal stromal tumor. The adverse effects include fatigue, cough, rashes, anorexia, diarrhea or constipation, then hematological toxicity such as neutropenia, thrombocytopenia, bleeding, myalgia and night sweats. Imatinib is a CYP enzyme inhibitor, so it increases the toxicity of simvastatin. Question number 25 is bevacizumab. You remember this is having the letter VA, so it is related to vascular. It's a monoclonal antibody, blocks vascular endothelial growth factor, which is highly expressed in some of the tumors, such as solid tumors such as ovarian, colorectal, and renal cell carcinoma. It is also used to treat dysregulated angiogenesis in wet age-related macular degeneration. The adverse effects include arterial thromboembolism, hypertension, and hemorrhage. Then question number 26 is rituximab. It's a monoclonal antibody, anti-cancer drug binding to the CD20 complex and causes B-cell lysis. Used in treatment of non-Hodgkin's lymphoma, that is B-cell tumor, then chronic lymphocytic leukemia, and it is also used in treatment of autoimmune disorders such as rheumatoid arthritis and Wegener's granulomatosis. The adverse effects include infusion reaction, tumor lysis syndrome, increases the susceptibility to infections, pulmonary toxicity and neutropenia. Question number 27 is miscellaneous drugs, hydroxyurea. It's a DNA synthesis inhibitor, inhibits ribonucleotide reductase. It also increases the fetal hemoglobin levels. So it is used to treat myeloproliferative disorders in chronic myeloid leukemia, polycythemia vera, and it is also used in treatment of sickle cell anemia. Adverse effects include bone marrow depression and GI upset. And question number 28 is lenadilomide. It's an immunomodulator. It's a derivative of thalidomide. It promotes cancerous cell death through multiple mechanisms. It's used in treatment of multiple myeloma, selective lymphomas, and myelodysplastic disease. The adverse effects include bone marrow depression, venous thromboembolism, and it is a teratogen. Question number 29 is a short note on aldeluskin. It's a recombinant interleukin 2. It induces the multiplication and activation of T cells that act on the cancerous cells and kill it. It is used to treat metastatic melanoma and renal cell carcinoma. It may cause capillary leak syndrome and GI distress and tachycardia as adverse effects. Question number 30 is L-asparaginase. It is an enzyme which is used as an antineoplastic agent. Some tumors, they require L-asparagine for its multiplication. The cells are deprived by this enzyme. It breaks down the L-asparagine and makes the cancerous cells deprived of L-asparagine. It's used in treatment of acute myelocytic leukemia. Adverse effects include a severe hypersensitivity reactions and acute pancreatitis. Question number 31 is pentostatin. It is a short note on pentostatin. It's an enzyme inhibitor used as antineoplastic agent. It inhibits the enzyme adenosine deaminase, inhibits the processing of DNA for cell division in the T cell tumors, used in treatment of hairy cell leukemia. Then the last section is toxicity reduction in anti-cancer therapy. These may be asked in 2 marks. I have given several toxic drugs used as anti-cancer drugs and the antidotes. Methotrexate causes stomatitis hepatotoxicity, which is reduced with the antidote folinic acid or folic acid. Cyclophosphamide causes bladder toxicity, which is reduced by mercaptoethyl sulfonate, MESNA. Chemotherapy induced nausea and vomiting is controlled by 5-HT3 antagonist, that is ondansetron, palanosetron, dexamethasone, lorazepam, aprepitant. Doxorubicin cardiotoxicity is reduced by dexrazoxane. Then cisplatin induced neurotoxicity, nephrotoxicity, and radiation induced xerostomia are controlled by the antidote amifostine. Hyperuricemia caused by the anti-cancer drugs are controlled with allopurinol, and bone marrow depression causes reduction in the neutrophil count, which could be revived with filgrastim, which is a granulocyte colony stimulating factor. I hope it's a short information of all the anti-cancer drugs and the probable questions with answers. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel. If you like this video, kindly press the like button and encourage us. Go through all the series of videos for 6th semester which is available in the Pharma Topics channel and score well. Thank you.